So I'll give just a brief background on the project. And so to begin with, I'll introduce the HIVE, and that's different from this Curtin HIVE. It's the East Metropolitan Health Services HIVE. It's health in a virtual environment. And it's a remote monitoring system that's at Royal Perth Hospital and Armadale Hospital. And it just acts as a second pair of eyes for the ward staff that are taking care of the patients in the hospital. So there's a team of senior doctors and nurses that are in a centralized location within Royal Perth Hospital. And they just have access to, as you can see in the image, like live patient monitoring data, medical imaging, all that kind of stuff, so that they can monitor the patient, monitor their condition, and if anything goes wrong, they can get in contact with the ward staff and help them out and assist them. And currently, they don't have access to any data that in relation to the movements of the patient or what the patient's doing. They can call in to view the patient, but obviously that can't be done all the time, and then there's privacy concerns with the patients being recorded. So, and it's hypothesized that the integration of movement data, along with their current monitoring and physiological data, will improve the function of the HIVE and also improve the health and recovery of the patients. And that can happen as sort of like a canary in a coal mine, sort of demonstrating like if something's going wrong with the patient, like if their heart rate is increased and they're moving a lot, then maybe that's fine because it's because of their movement. But if their heart rate's increased and they haven't been moving, then it might be an issue. And also, it could help with the rehabilitation and further research into rehabilitation and recovery of the patients, because there's a lot of sedentary behavior when patients are recovering from different illnesses and surgery and that kind of stuff. So the main objective of this project was to map the data captured from Inertial Measurement Unit sensors to a 3D human body model of a person in a hospital bed. And the Inertial Measurement Unit sensors, they've got a combination of an accelerometer, a gyroscope, and a magnometer. And the ones that we used for this project, I've got one right here. They're made by a company called XSense, and they make these motion capture sensors for films and for game development. And these ones in particular, they're Bluetooth sensors, and they're used for motion capture in sport and also health. And yeah, they're highly accurate sensors because they fuse the data collected, so they measure linear and angular acceleration along with the magnetic field, and they can combine all that data together using a specialized algorithm that's been tailored for human movements, and that just can produce a very accurate, in this case using orientation data, so just it can be used to find the angles of the joints and how they move over time. And here's an example of just applying one of the sensors and what they look like on the body. And they can also be put on in different ways, like using straps and Velcro. So visualizing movements using IMU sensors, what does that look like? So here I've got an example of me lying down in a bed, and I've got a few sensors on me. You can see one on my arm there and on my head and my leg. And then that's translated into a visual representation of a 3D model. And it's, as you can see, like none of the features of the model are identifiable as being me. It's purely just the movements, or in this case, the position. And then privacy is extremely important because patients in hospital are in a vulnerable state. So using these sensors, they're measuring purely just the inertial measurements. So the angles and the motion, and they're not. So this means that we don't have to record using cameras or anything like that. And let's go over the method and what I did. So selecting the software, I use Unity, which is a game engine. And although this isn't a game, it's using user input and input from that's being streamed in from the data, from the sensors, and that's manipulating the 3D models within the program. So that's why Unity is very helpful, and it just provides a lot of tools that you can use to develop the software. And then there's connecting to the sensors. So there are Bluetooth sensors, and I've used a Bluetooth connection module created by Adil, and he's a previous honors student, and he wrote that for his honors project. And then I did some initial testing, just starting off with mapping the rotations of the sensor so that it matches the on the screen representation, because Unity and the sensors, they use a different coordinate system. So initially, I just had to make sure that the mapping was accurate, and then I created the scene. And in the scene, I just wanted I wanted it to provide like the visual context of a hospital setting, but not to have too much going on, and for it to not be distracting to the user, so that you could focus on the movements of the person. And then starting off small with the 2 sensors on the arm, and then expanding that to the full body. So I've got a recording here of me moving around. And in this recording, I've got 7 sensors on me. So I've got 1 on my head, 2 on each arm, and 2 on my legs. And that's just a demonstration to show the full movement, but it's not necessarily applicable to all cases. Like, not all people would require 7 sensors. There might be some cases where you just need 1, or it would depend on the different cases. And then creating a user interface to adjust different settings, such as assigning sensors to different parts of the body, changing the view so you can look around the bed from different positions, and that kind of stuff. And then data presentation and secure recording of the data. So it's like experimenting with different ways of representing the joint angles, and also securely saving them to a research drive. And this example, this is just me moving my head around quite quickly. It's just saved to a CSV file, and then I've just gone into Excel and plotted it out. And this example on the left, there's some movement, like range of movement sliders. So you can see the X, Y, and Z axes. And then when you move the joint, the slider will move with the angle, and then you can set the range of motion limits. And then if it goes past those limits, like it'll light up saying the limits have been exceeded. And then also event-based alerts based on the quality and quantity of movement, such as the quality of the position that they're in or the level of activity. So if the person in the bed hasn't been moving, then it can set off an alert saying this person needs to be moved. Because if people are in the same position for too long, they can develop bed sores and have poor circulation and that kind of stuff. And then I'll give some examples. So you can see on the right, that's an example of the person not moving in a long time, and that time can be set to different times. And then also on the left, that's an example of a improper position, I guess. So if a person's been put on their side, and they haven't been put on their side correctly, where their hips are still flat, but they've rotated their upper body, then that can cause some issues, and that can occur. So that's just an example. So in that case, you can have one sensor on your upper body and then one on your lower body. And if you're on your side and they're out of line, then you can determine and just present a warning and say this might be an issue. And that issue can be checked. And then I've got some recordings of some further results. So this is an example of minimizing number of sensors. So just having just one on the upper body to determine the movements, like the frequency of movements and the position changes. And then you can add on further sensors to view the movements of other parts of the body. So I've just added one onto my head, just as a demonstration. And then this is an example of the range of movements. So I've got one on my head, and then I'm moving them in all the axes of movement. And you can see there we go. So if it exceeds the range, then it'll light up, and the corresponding axes will light up. And then you can adjust those bounds. So you can imagine if somebody's had some kind of injury where they can't move around too much, you could do something like this, where you just bring in the limits, and then if they move, then it'll light up red. There we go. Cool. And there's lots of future work that could be done with this project, but just one of them I'll briefly mention is to resolve some of the Bluetooth limitations that I faced. And that may either be through reworking some of the aspects of the Bluetooth module, because it wasn't really written for this purpose. It was created for fewer sensors. But also there's just a limitation in the Bluetooth communication protocol that means that you can only connect to 7 devices. So if more than 7 is required, then they could look into using a different communication protocol. And then I'd like to acknowledge my supervisors, Associate Professor Kylie Hill, Siavash Khaksar, Professor Tele and Wesley Lamont, and also all the help that I've gotten from all these other wonderful people. Kylie, Adele Yatin, Joshua, Dr. Meg Harold, Eliza Stewart, and Alex Ferres. Thank you very much.